According to the AHRQ Patient Safety Network, alert fatigue is a term used to describe how healthcare professionals become desensitized to safety alerts and as a result ignore or fail to respond appropriately to such warnings. This phenomenon occurs because of the sheer number of alerts and is compounded by the fact that the vast majority of alerts generated by computer physician order entry systems and other healthcare technologies are clinically inconsequential, meaning that in most cases, clinicians should ignore them. Hundreds of alarms signal per patient, thousands of alarms signal on each unit, therefore tens of thousands of alarms signal throughout a hospital. 85 to 99% of alarm signals do not require clinical intervention. Clinicians become desensitized, overwhelmed, or immune to the sound of an alarm. They may turn down the volume, turn off the alarm, or adjust the settings. From January 2009 to June 2012, 98 alarm-related events were voluntarily reported to the Joint Commission. 13 resulted in permanent loss of function, 80 resulted in death, and 5 resulted in unexpected additional care or an extended stay. How can you reduce alert fatigue in your medical practice? With the help of Active Health Management, a leading provider of health management services, including disease management, clinical decision support, and personal health records. Their solutions are powered by the CareEngine system and help to improve care for 18 million people nationwide and help health plans and employers lower costs.
Solution. Our proposed solution is to use a system created by Active Health called CareEngine that continuously collects information and analyzes data in order to minimize excessive and unnecessary alerts. The CareEngine platform is managed by a team of board-certified physicians, pharmacists, and registered nurses based on established clinical guidelines. It assesses each member's available health information across more than 1,200 health-monitored events and based on more than 9,000 clinical rules. Everything from medical claims and data findings to pharmacy and lab data is pulled in and matched with accepted clinical standards to create useful insights for their clients. According to Active Health's website, the CareEngine identifies and generates clinical opportunities to the treating physician called care considerations. CareEngine then issues clinical prompts based on administratively derived clinical data, which then allows physicians to make informed decisions about their patients' care without overwhelming them. Anchor et al. 2017 also mentions that approaches to reduce the numbers of within-patient repeats could be a promising target for reducing alert override rates and alert fatigue. We propose the use of CareEngine as a tool for physicians and caregivers to respond to alarms that are precise and require definite intervention as opposed to false alarms. The goal of using CareEngine is to decrease high volume and rate of false positives that undermine the purpose of detection systems.
At the foundation of the CareEngine system is the Active Health Clinical Development Center. This is a large team of full-time, board-certified healthcare professionals that support the system by developing and maintaining evidence-based rules, algorithms, and matrices. The work begins with a formal annual evaluation of all programs and clinical guidelines, including rigorous reviews of evidence-based literature. The team meets daily to discuss new issues and developments in the medical field. Afterward, the group develops tests and implements clinical rules and results from their literature review. The information is then made actionable in care considerations. Care considerations are clinical alerts issued by the CareEngine system that suggest stopping a potentially dangerous medication, adding a medication, or suggesting a procedure that hasn't yet been conducted. Care considerations enable more educated treatment decisions, avoids medical errors, and leads to fewer serious and costly negative events like hospitalizations. Kevin learns from a care consideration that the St. John's wort he's been taking to manage his mild depression can reduce the effectiveness of the anti-rejection drug used to help him after his transplant. After talking with his physician, Kevin decides to stop taking the herb and start another therapy to treat his depression. Carol's daughter has sickle cell disease. She is reminded of the importance of talking to her physician about getting an imaging test to check for abnormalities in her daughter's brain to provide early detection for risk of stroke. As a result, this critical test is performed. Sue smokes and has diabetes. She and her physician receive a care consideration that suggests the addition of an ACE inhibitor to her treatment plan. This could help reduce her risk of heart attack or stroke. Because Sue and her physician were informed of this opportunity, they decided to begin her on this treatment. Sue is happy and healthy as a result.
Buyers can expect a significant cost when implementing this system. The cost would include the programming, designing, maintaining, and troubleshooting support that accompanies this type of technology. One article states that the cost of a system like CareEngine can average as low as roughly about $163,000 per provider, depending on the number of providers a facility has, and a little bit of calculation, it can estimate the cost of the CareEngine system for that particular hospital. Based on this information, the facility can then determine if they can allocate the appropriate funds needed to implement this type of technology in their facility. The length of time and process a system like CareEngine can take is roughly about a year. Every phase of the process is about 3 months, and each phase is as vital as the next. In 12 to 9 months before launch, get support for hospital leadership, create a goal plan that focuses on implementation, training, and provisioning. During the 9 to 6 months before going live, it is important to launch a project team and define roles and responsibilities. In 6 to 3 months before launch or going live, evaluate the readiness of physicians and nurses within the hospital setting. Schedule training of staff and additional training for other users. Reconcile installation timeline with vendors' timelines, and also notify patients of the new system. 3 to roughly about a month before going live, it is essential to build and test interfaces and readiness of the system. Roughly about 30 days before launching the new system, it is important to customize templates, reduce patient load, assess and recheck the system and its workflows. Also meet with staff midday and days end to gather feedback and what can be changed.
All of Active Health solutions are tailored to seamlessly integrate with existing care management systems. If interested, the Active family offers additional programs.
The benefits of a system like CareEngine are many. For example, a patient was put on a medication called Limitrex for his recent migraines after seeing a neurologist. Unfortunately, the neurologist was not informed that his patient had an angioplasty for his coronary artery disease several years ago. From medical perspectives, being placed on Limitrex can be very fatal for patients with history of coronary disease. Limitrex increases chances of a heart attack in patients with coronary heart disease. Sadly, this scenario is very similar to most, if not all, patients who see several providers in their lifetime and lack the communication needed to provide better and cost-effective care. Every time a medical claim is submitted or prescription is filled, this data is absorbed by the CareEngine. With this information, the CareEngine then compares it against thousands of clinical algorithms that are taken from evidence-based sources. Patient information is constantly being scanned and published. Medical findings are also being added for clinical development as they become available. It also enables smarter and stronger communication between patients and providers that can prevent a serious life-threatening error. The CareEngine consolidates all the necessary patient information needed to provide the best care, analyzing all appropriate data to present the most appropriate alert for the healthcare providers. This helps the healthcare provider understand that when an alert presents itself, it is the most crucial alert and needing to be addressed and not a simple redundant alert that can be ignored, essentially preventing alert fatigue.
What should we know about CareEngine? According to a large-scale clinical trial conducted by Active Health Management at QualChoice, CareEngine was able to identify the following: 46 potentially serious medical errors per 1,000 people, and there were also 8.4% fewer hospitalizations. $8.07 per member per month was also saved. The care considerations recommending screening, diagnostic, and monitoring tests experienced the greatest increase in compliance, about 26.4%, compared to the control group. Success after implementation. Part of implementing a solution involves making sure that what you set out to achieve was successful. After introducing CareEngine, the next goal would be to measure its overall effectiveness and value. An analysis would be conducted to see if the use of CareEngine actually reduced the number of unnecessary medical alerts and how well it reduced medical error. We would measure the success of CareEngine by seeking to answer the following questions. What effect does CareEngine have to the problem? Are users adopting the solution, and was it easy to use? If holes appear during implementation, how will they be closed, and what improvements can we make to CareEngine for the future? We would also review how closely CareEngine's results matched the original objectives in terms of quality, costs, and satisfaction.
One limitation to addressing alert fatigue pertains to the legal consequences of removing alerts. A recent AHRQ Web M&M commentary pointed out that system developers have thus far been reluctant to remove alerts for fear of being held liable if patients were harmed in the absence of a warning. There has been progress toward developing guidelines for high-severity alerts, which warn of significant risk of harm and should be retained. Low-severity alerts are clinically less consequential warnings, which could be made non-interruptive or removed entirely. In conclusion, we recommend Active Health Management's product CareEngine as a potential solution to combat alert fatigue in healthcare practices small and large. The system encourages users to focus on people and not conditions and pinpoints individual issues that enable opportunities for better care.